Hello, everyone. I'm Paul Whiting, Chief Executive of AVMA. We're the UK charity that supports people who've been avoidably medically harmed. Thank you for joining us on this important discussion on the harm patient pathway, a crucial topic for anyone committed to improving patient safety and the experience of patients and families after harm has occurred. Today, I'm joined by my predecessor, Peter Walsh, MBE, and Joe Hughes from the Harm Patients Alliance, both people deeply involved in advancing patient-centred responses when harm occurs. Our aim in this session is to unpack what the harm patient pathway is, explore why it's needed and how it came about, and to start to think about how organisations can work together to implement it effectively, reflecting on what true patient-centred support looks like. To begin, I'd like to ask each of you to briefly introduce your role and connection to the harm patient pathway. And if each of you could then sort of share in your own words what the purpose, in your view, the harm patient pathway is and what the problem it's trying to solve. So, Peter, if I can, I'll start with you.
Okay, thank you, Paul. I had the privilege of being CEO of ABBA myself for 20 years. And the biggest thing that affected me during that time was hearing from people who'd experienced harm and learning how the way that the NHS or private healthcare, for that matter, responded to them and dealt with them following an incident actually caused terrible harm in itself. It's what people call a second harm or compounded harm. And I literally saw and got to know people whose lives had been devastated, turned upside down, uh, by the way that they were dealt with after an incident, which was almost as bad as the physical harm that was caused in the first place. So, although we did fantastic work at ADMA in campaigning for a legal duty of candor, even when that was in place, we began to realize that on its own, it isn't enough. That what staff and organizations needed was an understanding, a framework of how to deal with people who'd experienced harm, both patients and the people closest to them, in a compassionate and empathetic way that met the very specific needs that people have in those circumstances.
That's really helpful. Thank you, Peter, and thank you for elaborating, on your sort of extensive experience there. Joe, can I turn to you? You bring a different experiences altogether, and I wonder if you could share your view on this and introduce yourself as well.
Yeah, thanks, Paul. So I'm Jo Hughes. I'm one of the co-founders of the Harm Patients Alliance, which was set up in 2020 with James Titcombe. And we are both people who have had our own personal lived experience of harm in healthcare. We both had the loss of our children. And the experiences that Peter just mentioned, that AVMA hears so much about in terms of the responses when things have gone wrong and a patient has come to harm as a result, causing further distress, stress, trauma really for families, for patients and their families. James and I have lived all that ourselves. And so and also over the many years that he and I have sort of been working within and around patient safety, obviously we've met so many people who also have had their own experience with healthcare harm and their experiences with compounded harm afterwards. And in fact, sadly, it's probably rare to meet someone that didn't have a story of compounded harm, and the distress that was caused from the way things were responded to for them. So for me, the purpose of the harm patient pathway is really to try to enable um, the vision for a response to harm that is focused on what has been the human experience of what has happened, what have been the actual impacts of that for human beings, what are they now living with that wasn't there before this happened, and how can we help people so that they can move through what's happened to them and reach as much healing as is on offer in the circumstances. And so for me, the problem I think that we're trying to solve is to say to healthcare that yes, we need a learning response to patient safety incidents or systemic problems, but we also very much need a healing response to human harms and the needs that come from those when those happen. Thank you.
Yeah, that's really helpful. Thank you, Jo. And I mean, just to bring a personal element into this for me, I joined AFMA just around 3 years ago. And when I joined, I met you fairly early on, Jo. And obviously, Peter talked to me at that point about the work that had been going on around this concept of a harm patient pathway. So the gestation for this has been some time. And I wondered if you, Jo, could just say a bit about how this took shape, because clearly you've been involved in it from the Harm Patients Alliance. AFMA, as Peter was just explaining, has also been involved. So how did this come together, the two organisations, to make this happen?
Yeah, so I suppose from sort of with James and I, we'd had so many conversations talking about, what did we need after it happened to us, and what would it have looked like for us to be, feel that we were cared for and that we were being helped to heal. James often says, "Oh, if they'd have wanted to help me heal and recover, they sort of did the exact opposite of what of what they needed to do." So we'd been talking about that for a long time. And I had almost from the moment that I'd lost Jasmine, sort of started to notice that the responses were not set up specifically to support me, both in my grief, but also in the fact that I'd experienced this thing called healthcare harm. So I think the thinking for us was around this idea that the healthcare harm element, the coming to harm as a result of your healthcare, that experience itself is almost like a diagnosis that almost requires its own response, evidence-based response, really, to what does help people who have experienced that get through it, understand it, come to terms with it, process it, and being able to live with the fact that it's happened for them going forward. So we were very much speaking along those terms, and we set up Harm Patients Alliance, very much thinking about that work going forward, wanting to raise awareness of this problem of compounded harm, that responses are not helping people heal. Surely healthcare should be focused on helping people heal when these things happen, and what could be done to support that. And we were speaking with Peter. Peter was doing lots of work with AVMA, looking at what were the needs of beneficiaries and what was missing. And together we decided to embark on this project combined, and bring our combined expertise to it. I'm sure Peter might have more to add to that. Yeah.
Yeah, no, Peter, anything you want to say about that? I know you did a lot of work mapping out patient journeys and sort of some of the gaps. Was there anything you'd like to add around how this came about?
Yes, just to add, we at AVMA, the board of trustees and the staff of AVMA, at about the same time that Harm Patients Alliance, Jo and James were looking at the needs of people when they've been harmed in healthcare, we also were taking a very deep look at what we called then the journey that our beneficiaries went on after they'd experienced harm. And that work helped us map out a whole range of things that were missing in terms of what people need when things have gone wrong and caused harm in healthcare. So really, sharing our learning from our vast number of beneficiaries who've experienced harm with the Harm Patients Alliance made us realize actually we're looking at very much the same things. And I think what's evolved is something that's really exciting and unique, a completely new way at looking at the needs of people who've been harmed. As Joe said, people have some very specific needs, both emotional and practical. And the way that people need to be responded to is more than just being nice to them. I think the default situation or guidance to the NHS and other healthcare providers has been, we've got to be sympathetic and compassionate to these people. Well, yes, that's not a bad start, but there's an awful lot more. And I think one of the unique concepts involved in the harm patient pathway is that we, as Joe said, look at harm patients as a particular cohort of people who have special needs following harm, in the same way that if you have a group of patients with a clinical condition, such as a heart condition, diabetes, etc. And so that led us to think about, well, look, rather than a journey, let's think about it as a pathway to recovery, to healing. And let's make the comparison, the alignment with the idea of a clinical care pathway that actually strategically looks at those people's individual needs within a strategic framework that's best set out to help them. So taking that together with the concept of a moral duty of care, again, in healthcare, it's common knowledge that people have a duty of care towards patients. We're starting from the point that people have a moral duty of care to people who've been harmed, not just the patients themselves who've been harmed, but the people closest to them also. So the harm patient pathway tries to bring all those things together in a practical way that can help healthcare providers respond in the best, most appropriate way possible.
That's really helpful. Thank you to both of you, because I think you've kind of provided a really good summary of kind of both the sort of systems level approach that's going on here, but also at the same time, really thinking hard, and particularly Joe, or both of you actually have brought it out, this issue about the human responsibility, the moral responsibility, and thinking about the practical issues of supporting people in a real one-to-one sort of human way. And that really comes across to me really powerfully, actually,